I was in Northern Ireland, during a holiday. 2015 ki baat hai ye. In 2015, I had gone to UK. I was playing, in fact, in England, and then took my days off and I travelled to Scotland and then went to Northern Ireland. And at one place in Northern Ireland, I saw a cafe. Okay, and I went in because it was cold and raining and everything, and I thought, I'll go in and grab a cup of coffee. Went in to realize that it was not a regular cafe. It was a vaping cafe where you could actually sit down, ask for your flavor of vapes, and smoke for an hour, and you pay by the hour and whatever the number of flavors and everything. And I was like, hang on, I mean, why have I got myself into a smoking chamber? I walked out, walked further up, got myself a cup of coffee from a proper coffee shop, and I walked out. But that raised many questions in my mind. Maybe that place, or that cafe, or the vaping cafe, was way ahead of its time, because today I see vapes in hands of literally every third person that's walking around me, and that puts a question in my mind, that what is it that is attracting these young kids, the teenagers, towards vaping? And there's a research that has come through which has said that this is not good. How, I mean, teenagers getting into this is probably the worst thing that could happen to the generation to come. To talk more about that, we've been joined by a consultant pulmonologist, Dr. Emadeldin Ibrahim from Medcare Hospital. Dr. Ibrahim, welcome to TSB.
Thank you very much. I'm very honored to be with you today, and it's a really hot topic to talk about it.
I'm so sure that within your experience, there were not just problems that came up from smoking of cigarettes and everything already, but now there is another layer of challenges that come to you as a professional when you see people who are smoking vapes, and they look so colorful and so fancily packaged that it almost looks attractive to every teenager.
Yes, true. This is one of the issues that regulations now in most of Western countries and US is trying to abandon any attractive colors or any attractive flavors for vape, because in the beginning of this era, the recommendation was that use this one for quitting smoking, and until now it is not approved by the FDA for method of quitting smoking because of many things.
Mm-hmm.
There's many issues about this vape. First, we are not sure about the problems will come up after this use of vape. In 6 decades, we know about cigarette smoking that they have 7,000 toxic materials, and we know about the effects of smoking. For vape, it's a recent one, and the problem is, as you said, it was said by Boston Globe that in 2017 it is the most common phenomena that vape is with few years become a common phenomenon for everyone, even for younger children and the adolescents, which is very dangerous because at this age they have not developed fully their organs, especially the brain. The brain take about many years until the mid-20s to be fully developed. The lungs until 18 years still growing up. So they destroy their brain, they destroy their heart, they destroy their lungs, and they don't know about it. And a lot of materials in the vape, even it is less than cigarettes. I agree with that, but still it is a big problem because you have heating coil, even in this e-cigarettes by certain company, I'll not mention the name, but it is already known.
Right.
And even the vape, they have coil, and this coil heating up to 200, 250 centigrade,
right,
which equal about 480 Fahrenheit. So it is heating of these materials, causing a lot of other materials we don't know about it.
True.
The only thing we know about it is about diacetyl, which is present in the flavor, and this causes something called popcorn lungs, or this bronchiolitis obliterans, which is very dangerous disease, causing small airway disease, and the small airway disease consisting 70% of the airway. So you are destroying 70% of the airway in younger children. Okay.
Oh my God.
Also, there is many cancerous materials. There is formaldehyde inside it. There is nickel. There is lead. There is tin inside this material. So it is cancerous. It is not free from cancer.
Right.
And also, acrolein, which is some chemical material. We use it to kill weeds in the garden. It is inside the vape. So how come you tell me it is safe one? It is not safe.
I totally agree with you when you say that, because doctor, I was talking to someone, and that someone is a very regular vape smoker, and that person told me that, listen, I smoke a zero nicotine vape. Okay, the fluid, that the liquid that I put in my vape is zero nicotine, so it is only the smoke, and it's essentially water vapor. I couldn't understand the concept behind that conversation, and I said that, your lungs, your life, but I still don't think that it's not a green vegetable, leafy vegetable that you're eating and putting in your body that you're challenging.
Yes, sir. This is true. Let me answer this one. Because of one of my colleagues, he's a doctor, and he said to me, who was talking to me, I said, this is an ice. It's not an ice. It's only because it has water inside and some vapor. You feel like it is cold, but it is not cold. So and the lie behind it is having zero nicotine. This is a big lie. Because in the e-cigarette, which is by one of this cigarette company, it has nicotine inside.
Oh, okay.
And this oils, which is coming from under the stairs, we don't know about the compositions. And in US, they found one of these oils. They have materials called THC, which is marijuana. It's a cannabis inside.
Okay.
So it's really is not zero nicotine, and even. And nicotine, by the way, before we miss this nicotine causing hypertension, causing arrhythmia, and causing sudden death in some patients. There is recorded cases of death because of vape. And also nicotine affects the brain and it delays the development in brain in young children up to it affects the cognitive performance. And cognitive performance is all about the brain. It is about concentration, about ability to learn, about reaction time, about memories. So it's really delaying this use behind and makes them delayed development. And the nicotine also affects the lungs and the brain, making addiction. So and it will be a step to smoking, because these younger children, if you start with this one, in a few years, you will try to try something else. So they will try smoking by the end. And yes.
So when you say that, with so many harmful effects, and it's one must credit the creators of it by creating a fancy looking product, in colors and flavors, making it look like that, hey, this is a good thing that you should have. Cigarettes are not good because they don't probably smell good, they don't taste good, or the whole look and feel is very boring, versus the vape, they look so good. Aren't there any regulations on the manufacturers on or any restrictions on how or what it should be?
Yes, I think some Eastern countries and Europe and US, they start to make a rule to abandon any attractive colors or any attractive flavors, to try to reduce the use by the use, and also they put a rule that most of the countries they put age of 18 for to buy this vape. Before it was open to everyone.
Okay.
So I think my thinking about this point especially, I think education is more than important in this issue. We have to teach young people about the harmful effect, like your program here, and the parents to be aware about the harmful effect. If they are afraid of this one, they will not use it, whatever it's colored, not colored. Because in India, for example, they found that the students they sell the vape inside the schools. So you will not be able to control. You will not put guard after everyone, but you can teach them how much you will destroy. You know what? I am consultant for 30 years.
Right.
And in few years, and I found this young youth coming to me with chest pain. This is not mentioned in the text.
Right.
They come with chest pain, severe chest pain, not explained. Some of them did cardiac catheterization, and they came to me. I asked them 2 questions. Do you vape? They said, yes, I am vaping. Do you have vitamin D deficiency or not? Because this is most common when you find everything is normal. And at the end, we find that vape is the reason.
Right.
and this is alarming because also not only this one, but also it causes asthma, it causes infection, it causes
Hmm.
something called lipoid pneumonia.
Okay.
Lipoid pneumonia is the oil coming inside the lungs, making chemical pneumonitis,
Wow.
which is destroying the lung, ending by fibrosis. So how can we leave
I know.
our kids and our children like that? We have to have more restriction and more teaching for them to stop.
I completely agree with you when you say that, education is extremely important, because right now when you say that, there are so many harmful effects of smoking vape, it is alarming. It is, shocking, because no one ever speaks about all of these things. They only talk about how good it is, or probably how slightly bad it is. But because you, with your experience and with so much knowledge that you possess, when you share these details, and I'm so glad that, we're having this conversation. We're trying to educate every single listener who's with us right now, doctor. But tell me this, that when someone says that, hey, good flavor, bad flavor, I'm just smoking it not very regularly, I'm just smoking it once in a while, what is the communication, what is the conversation that one can have with them without trying to get into their personal space? And when you get into someone's personal space, what happens? They push you away.
Yes,
So
true.
what is a conversation that one can have to educate someone who says, oh, I'm a casual smoker, I just do it like once in a week, or just socially when I'm like with my friends, probably like that.
Yes, they found that I think the best way is to talk about the harmful effect of the vape away from his talk. Don't push to tell him stop. Just
Mm-hmm.
tell him the knowledge he doesn't know about it, like
Right.
telling about the complications, telling about they found that one bout of vape, one session
Mm-hmm.
equal to one packet of cigarette smoking.
Wow.
So because how long do you smoke cigarette? 5 minutes, 10 minutes, and it's finished.
Right.
Okay, but they smoke for hours, my friend.
True.
They smoke for hours,
True.
and and they have like a vapor coming out like barbecue. So it's really a point of view that you handle the complications and the long effect on their lungs,
Mm-hmm.
and their brain. So if they get this point, they can think in because uh, it's harmful to smoke and harmful to take vape. It's both of them are condemned and both of them are bad. But some people will take this one and say, "I am better when I smoke vape because
True.
yeah, I
Yeah, a
feel
lot of
better."
them say this. Yes, you're right. You're right.
Yeah, so
It's
you
like
have to
one of
hide.
yeah. It's like, choosing the lesser devil of sorts.
Yeah,
But it still has really bad effects, and I'm so glad that, we had this conversation, doctor. I think we should do this a little more regularly, where we talk about the harmful effects of any form of smoking, so that, we put this communication out to a lot of people, and from within ourselves we know that, we've taken one step closer towards a better future. Thank you so much for your time,
good.
sir.
So it's my pleasure. Thank you very much, and I hope for all the best health and wealth, inshallah.
Thank you so much, sir. That was Dr. Ibrahim, the consultant pulmonologist from Medcare Hospital in Sharjah. We're talking about the harmful effects of vaping, as UK is now cracking down on the sale of disposable e-cigarettes to curb down its usage amongst children. And mind you, as I said, my first experience of understanding what vaping is was way back in 2015, when I was playing in UK, and I had gone to Northern Ireland, and I entered a cafe thinking that it's a cafe where I could get some coffee, but it actually was a vape cafe, like a legit vape cafe, जहाँ पे लोग बैठ के साथ में वेप करते थे. So ये चीज़ जो है वो काफ़ी सारी वेस्टर्न कंट्रीज में काफ़ी डेवलप हुई है. It is also spreading across within our regions also, within your community, within your friends, within your groups. Please try and dissuade people from vaping. It might be the lesser devil, but still is a devil. Neil on TS.